Students, very good afternoon to all of you. Then we will discuss about the treatment related to the gastrointestinal system. So, know about that. First, discuss about the nasogastric suctioning from the unit 14. So, in the nasogastric intubations, also you know that. So, in the nasogastric intubation, that is the also be inserted tube or insert a plastic tube through the nose, throat, then down into the stomach. So in the nasogastric intubations, tube goes to the stomach through by the nose or through by the nose or through by the throat. Why nasogastric intubations tube will be inserted to the stomach? Because to relieve the abdominal distension if due to the presence of accumulation of the more gases in the abdomen, to relieve the abdominal distension or remove the gases or maintain the gastric decompressions after surgery. For that purpose, nasogastric suctioning is done. If presence of any type of blood and secretion in the stomach, that for that reasons also nasogastric suctioning is done, and it will also be helpful for the provide the comfort to the gland. And also nasogastric tube also be inserted in the to maintaining the nasogastric tube. Nasogastric suctioning is done. If the NG tube is there, then any type of secretion is there, that is removed by the nasogastric suctioning also. What are the equipment we taken in the nasogastric suctioning? Equipment like the take the gastrointestinal tube, basin, 50 ml syringe, stethoscope, suctioning device, connecting tube, clean glove, cotton tube applications, ointment or lubricant. So first step, we should perform a hand hygiene and give the Fowler's positions to the gland. And after inserting the tube through by the nose and mouth, then the stomach, and it is confirmed by the osculation process through by the placing of the stethoscope in the chest, stomach. That is by the hearing the sounds, we confirm that tube is proper place in the stomach. Then put the gloves. Then aspirate the stomach content any type of gastric acidity, etc. By also we check the stomach content through by the check the stomach acidity by using the pH test strip. Always I have sent the visual picture how pH through by the pH test strip acidity is measured or checked. Then the inserted tube, different tubes will be inflated by the inserting air through by the syringe, so by which we easily hear the sound, listen the sound through by the stethoscope, and which is placed over the stomach. Then set and check the suction. Then connect the gastrointestinal tube through the in the suction machine, by which we release the secretion, any type secretions in the tube. Okay. Then apply the suction and watch the tubing for a few minutes until the gastric content will be appear that is running through the tubing into the receptacle. Then assess the drainage. So in the nasogastric suctioning, it is a procedure by which we remove the secretions and relieve the distensions, abdominal distensions, and also maintain the nasogastric patency. So you take the equipment like the gastrointestinal tube, basins, 50 ml syringe, stethoscope, suction device, connected tube, clean glove, ointment or lubricant. Then first we perform we should do the hand wash to prevent the cross infections and giving the Fowler's position for easily assessing the suctioning by the patient. Then confirm the tube is in the stomach, because after inserting the tube through by the nose, mouth to the stomach, and then confirm that tube is in the stomach. How you know that the tube is stomach? Before it, you should clean the glove then the what of the stomach content aspirated, that will be checked through by the and acidity will be checked by the pH test strip, and through by the syringe air will be inserted the tube, and tube will becomes the inflated, because before inserting the tube will becomes deflated, because if the balloon is attached, that balloon becomes the inflated after inserting the air into the tube through by the syringe, so that after that you insert that, the tube will be strongly fitted in the throat area, and the sound will be heard by the using of the stethoscope over the stomach. Then check the suctions. If you see that any type of aspirations blockage in the airway, and as well as the secretion is observable, and that is looks like stick is there, then by the attaching of the suction machine in the tube, that secretion will be removed. Okay, and how you confirm that suction machine is properly functioned, and the will remove the by which we remove the gastric content and any type of the secretions. After applying the suction, in which way? After applying the suctioning, wash the tubing for a few minutes, that through the tube, then the secretions is passed away in the tubing, by which we will confirm that the secretion is always be removed away. Then through by the drainage system, that assess the drainage, then the secretions will be through by the suction machines or through by the suctioning. Okay, ତାହେଲେ ଏଥିରେ କ'ଣ କଲେ ନା, ପ୍ରଥମେ ଆମେ ହାତ ଧୋଇବା, ହ୍ୟାଣ୍ଡ ୱାଶ୍ କଲେ ଟୁ ପ୍ରିଭେଣ୍ଟ କରାସନ୍, ଦେନ୍ ପେସେଣ୍ଟକୁ ଫାଉଲ୍ ପୋଜିସନ୍ ଦେଲେ, ତାପରେ ଷ୍ଟୋମାକ୍ଟା ଟ୍ୟୁବ୍ଟା ଷ୍ଟୋମାକ୍ରେ ପ୍ରପର୍ ଏଣ୍ଟ୍ରି ହେଇଛି ନା କେମିତି ଜାଣିବା ନା, ତା ପୂର୍ବରୁ ଆମେ ଭଲସେ ଭାବେ ଗ୍ଲୋଭ୍ସ ପିନ୍ଧିବା, ଏବଂ pH ଟେଷ୍ଟ ଷ୍ଟ୍ରିପ୍ ଦ୍ୱାରା ଯେଉଁ ଷ୍ଟୋମାକ୍ରୁ ଟ୍ୟୁବ୍ ମାଧ୍ୟମରେ ଯେଉଁ ଏସିଡ଼ିଟି ଗୁଡ଼ାକ ସବୁ ଆସ୍ପିରେଟ୍ କରିଥିବା ସିରିଞ୍ଜ ମାଧ୍ୟମରେ ସେଗୁଡ଼ାକ pH ଟେଷ୍ଟ ଷ୍ଟ୍ରିପ୍ ଦ୍ୱାରା ଟେଷ୍ଟ କରିବା, ଯେଉଁଟା ଭିଡ଼ିଓ ପିକ୍ଚର ଅଲରେଡ଼ି ମୁଁ ଦେଇଥିଲି। ତ ଏସିଡ଼ିଟି ଜାଣିବା ଯେ ଷ୍ଟୋମାକ୍ ଭିତରକୁ ପ୍ରପର୍ଲି ଇନସର୍ଟ ହୋଇଛି, ଏବଂ ମଧ୍ୟ ଆମେ ଷ୍ଟେଥୋସ୍କୋପ୍ ଦ୍ୱାରା ଯଦି ଆମେ ସାଉଣ୍ଡ ଶୁଣିପାରିବା, ଷ୍ଟୋମାକ୍ ଉପରେ ଯଦି ଷ୍ଟେଥୋସ୍କୋପ୍ ରଖିବା, ତାହେଲେ ଆମେ କିଛି ସାଉଣ୍ଡ ଶୁଣିବା, ବବଲିଂ ଟାଇପ୍ର ସାଉଣ୍ଡ କିଛି ଶୁଣିବା, ତାହେଲେ ଜାଣିବା ଯେ କ୍ୟାଥେଟର ଦ୍ୟାଟ୍ ଇଜ୍ ନାଜୋଗାଷ୍ଟ୍ରିକ୍ ଟ୍ୟୁବ୍ଟା ପ୍ରପର୍ଲି ଇନସର୍ଟ ହୋଇସାରିଛି। ଓକେ, ଆଚ୍ଛା, ଯଦି ସିକ୍ରେସନ୍ କିଛି ଆସୁଛି କେମିତି ଜାଣିବା, ଯଦି ଦେନ୍ ତାପରେ ସେ ନାଜୋଗାଷ୍ଟ୍ରିକ୍ ଟ୍ୟୁବ୍ଟାକୁ ଆମେ ସକ୍ସନ୍ ଟ୍ୟୁବ୍ ସହିତ ଆଟାଚ୍ କରିଦେବା। ସକ୍ସନ୍ ମେସିନ୍ ଅନ୍ କଲା ପରେ ଦେଖିବା ଯେ କିଛି ସିକ୍ରେସନ୍ ଯଦି ଟ୍ୟୁବ୍ ମଧ୍ୟରେ ପାସ୍ କରୁଛି, ତାହେଲେ ଜାଣିବା ଯେ ସେ ସିକ୍ରେସନ୍ ଗୁଡ଼ାକ ରିଲିଜ୍ ହେଉଛି, ତାକୁ ଆମେ କହୁଛେ ନାଜୋଗାଷ୍ଟ୍ରିକ୍ ସକ୍ସନିଂ। ଦେନ୍ କମ୍ ଟୁ ଦ ଗ୍ୟାଷ୍ଟ୍ରିକ୍ ଇରିଗେସନ୍ସ। Gastric irrigation is a procedure by which the stomach content will be cleaned, and stomach content will be it is a process. Gastric irrigation is a process of cleaning the content of the stomach. So gastric irrigation procedure द्वारा कौन है ना, stomach content गुड़ी को clean भाବରେ बाहर को बाहरी जाता है, and it is has been used for over 200 years. What are the purpose of gastric irrigation? Also, it is helpful to relieve the abdominal distension, maintain gastric decongestion, also remove the blood and secretion, and provide the comfort. Equipments like you take the stethoscope, clean gloves, and also taken the 50 ml syringe, and take the sterile normal saline. What is the procedure? First in the preliminary assessment, first prepare the clamp and equipment, then also insert the gastrointestinal tube through by the nose, and moisture resistant pad will be placed under the inserting part of the gastrointestinal tube. Then put the gloves. After inserting the tube, then put the clean gloves. Then tube should be irrigated. The tube should be cleaned through by the using the solutions, 30 ml solutions, 30 ml the normal saline solutions. By using 30 ml normal saline solutions, the tube should be cleaned. Okay, then attach a syringe to the tube, attach the syringe through the nasogastric tube. Then the solution slowly solution will be injected. Then it will goes to the stomach, and then the that contents will be after inserting the solutions. Then you injected 20 ml of air at the same time. Then the repeat the preceding steps until the order of the amount of solution is used. तापर कौन करिबा फास्ट आम 30 ml सॉल्यूशन इंस्टॉलेशन करिबा तापर जति दरकार हुए 60 ml सॉल्यूशन मध्य इंस्टॉलेशन करि परिबा. Then attach syringe tube nasogastric tube, slowly inject the solutions, then the gently aspirate the solutions. ताले एथरे कोन करबा जो हमरो गैस्ट्रिक इरिगेशन कला जे स्टोमक रे जहाँ कंटेंट रही ताको आम क्लीन करि परिबा गैस्ट्रिक इरिगेशन प्रोसेस माध्यम एथरे कोन करबा एथरे काम कहीं आम गैस्ट्रिक इरिगेशन प्रोसेस करे जा कहीं ना एब्डोमिनल गैस एब्डोमिनल डिस्टेंशन रुए किंबा गैस्ट्रिक डिकम्पोजिशन पई ब्लड सिक्रेशन को रिमूव करा पई गैस्ट्रिक इरिगेशन मते करा जाय थाए. एथरे कोन फास्ट कोन करबा टीन प्लांट को प्रिपेयर करबा ताको भल कंफर्टेबल पोजीशन दबा ताको प्राइवेसी प्रोवाइड करबा एवं प्रोसीजर शुड बी एक्सप्लेन डिटेल्स टू द व्हेन द कॉन्फिडेंस पेशेंट प्रोसीजर डिटेल कहबा इक्विपमेंट जहाँ भी अच्छे पाखे रखा. देन द गैस्ट्रोएंटरल ट्यूब नवा एवं ताको कौन करबा ना इंसर्ट करबा पेशेंट नोज माध्यम स्टोमक को एंट्री करबा एवं गैस्ट्रोएंटरल ट्यूब रो एंड पार्ट रे गोटे एंड पार्ट तले गोटे मॉइस्चराइजेशन पैड दबा. देन ग्लोव्स पिंधबा. देन तो कौन करबा ना फास्ट 30 ml सॉल्यूशन इंस्टॉलेशन करके ट्यूब को इरिगेशन करबा. तापर ट्यूब को भल भाव क्लीन करबा. तापर 60 ml सॉल्यूशन दे इंसर्ट करी मध्य ट्यूब को क्लीन करबा. तापर कौन करबा जेंटली कौन करबा सॉल्यूशन गुडा को ड्र करबा. सिरिंज में ड्र कले कौन हम जहाँ गैस्ट्रिक कंटेंट जहाँ भी रही है सब बाहर को बाहरी आसी थाए. ओके अच्छा एथरे कौन हुए ना 30 ml सॉल्यूशन हो 60 ml सॉल्यूशन देला परे किछि 20 ml एयर मध्य एंट्री करला परे कौन हम भल भाव जहाँ भी स्टोमक कंटेंट भल भाव बाहर को बाहरी जाए थाए. ओके देन कम टू द गैस्ट्रिक एनालिसिस. The patient who have the pyloric and duodenal obstructions, that type patients, in that type of patient has the any secretory activity of the gastric mucosa. Any secretions come from the gastric mucosa of the patient like the pyloric and duodenal obstruction patient. So how much degree of the secretion is there? How much gastric retention, how much degree of the gastric retention of there, what is the secret activity of the gastric mucosa. For providing more information, the gastric analysis done. ताले जो पेशेंट पाइलोरिक व duodenal obstruction रही से पेशेंट मानकर केते परिमाणर gastric retention रोच केते gastric mucosa केते gastric mucosa activity रोचन जहाँफल कि gastric एसिडिटी सिक्रेशन होची अधिका से गैस्ट्रिक जुइस को जानिया पई गैस्ट्रिक एनालिसिस करा जाय थाए. So patient here for the gastric analysis patient should be not for orally for 8 to non for orally for 8 to 12 hours before the procedure पूर्व 8 12 घंटा मध्य रे पेशेंट किछि खाइबो किछि खाइबो पीबो किछि करबोनी एवं तापरे any medications also which is provided that would help for 24 to 48 hours before the test पूर्व गैस्ट्रिक एनालिसिस टेस्ट पूर्व 8 12 घंटा मध्य पेशेंट किछि पानी ड्रिंक्स करबोनी किछि खाइबो नहीं नॉन पोरली रहिथिबो एवं टेस्ट पूर्व 24 to 40 आवर्स मध्य पेशेंट कौन से मेडिकेशन नब नहीं एंड स्मोकिंग इज नॉट अलाउड एट दैट टाइम. If you take a small nasogastric tube having the various with a catheter tip that marked a various point insert through the nose, then nose मध्य एंट्री करने जो स्मॉल नासोगास्ट्रिक ट्यूब निया जाए तार various point रे तार catheter tip थाए କ୍ୟାଥେଟ୍ରିବ୍ରେ ଭେରିୟସ୍ ପଏଣ୍ଟରେ ସବୁ କ'ଣ ମାର୍କ କରାଯାଇଥାଏ ଏବଂ ସେଇଟା ଲେବଲିଂ ମାର୍କ କରାଯାଇଥାଏ ଏବଂ ସେଗୁଡ଼ାକ ମାର୍କ ହୋଇଥାଏ ଥେକାମିନା ନାଜୋଗାଷ୍ଟ୍ରିକ୍ର ବିଭିନ୍ନ ପ୍ରକାର ପାର୍ଟ କେଉଁ ପାର୍ଟ କ'ଣ ଜାଣିବା ପାଇଁ। ଓକେ, ସେଥିପାଇଁ when take a small nasogastric at catheter various parts points is there while inserted through the nose. When the tube is at the point slightly less than 50 cm, it should be within the stomach lying along the greater curvature. ଯେତେବେଳେ ଜାଣିବା ଯେ ଟ୍ୟୁବ୍ଟା 50 ସେଣ୍ଟିମିଟର ଲେସ୍ରେ କ'ଣ ହୋଇଛି, 50 ଟ୍ୟୁବ୍ରେ ଯେତିକି ଲେନ୍ଥ ଅଛି ବା ଯେତିକି ଅଛି, ଯଦି ସେଥିରୁ ସ୍ଲାଇଡ଼୍ରୁ କମ୍ରେ ସେ କ'ଣ ଇନସର୍ଟ କରାଗଲା ତାହେଲେ ଜାଣିବା ଯେ ସେଇଟା ଷ୍ଟୋମାକ୍ରେ ରହୁଛି। ଓକେ, ଆଣ୍ଡ ହାଭିଂ ଦ ଗ୍ରେଟର କର୍ଭେଚର୍ and entire stomach content should be aspirated through by the inserting the syringe, inserting the air through by the syringe, then it will be aspirated through by the syringe. तार syringe माध्यम कौन हुए जी stomach content गुड़ाक रही aspiration करा जाए। and gastric samples are collected every 15 minutes for the next hours. प्रत्येक 15 मिनट रे कौन करवा गैस्ट्रिक सैंपल गुड़ाक आम कलेक्शन करनवा। ताले स्टोमा कंटेंट केमिति गुड़ा स्टोमा कंटेंट केमिति बाहर करा जाए ना सिरिंज माध्यम स्टोमा कंटेंट को ड्र करके ड्र करा जाए आस्पिरेशन माध्यम बाहर करा जाए। प्रत्येक 15 मिनट रे सैंपल कलेक्शन करा जाए। जो पेशेंट को पर्निशियस एनीमिया रही है, पेशेंट विथ एनी टाइप ऑफ डिजीज and there has not capacity no disease secret no acid under vascular condition after stimulation. The patient who has the severe chronic atopic gastritis or gastric cancer patient, pernicious anemia patient, that type patients patient acidity should be analyzed by the method known as the gastric analysis method. Here they will throw by the gastric analysis method, gastric juices, information about gastric juices comes. ताले गैस्ट्रिक एनालिसिस मेथड द्वारा आम कौन करें गैस्ट्रिक जुइसेस केमती सिक्रेशन हो तार एक्टिवेशन केमती रोचे केते परिमाण सिक्रेशन हो जानी होता है। ओके, जहाँद्वारा कि आम पेशेंट को भल ट्रिटमेंट कर। Here we administered histamine and pentagastine that are helpful for the stimulate the gastric secretions. If you stimulate the gastric secretion, the more amount of gastric acidity will becomes, and by which we take the sample within 15 minutes. Then it is checked, and how much acidity present it will be determined by the test. That is known as the gastric acid stimulation test. So gastric secretion collected after the injection every 15 minutes for 1 hour. Then the volume of and pH of specimen also be measured. Then come to the pH monitoring. So for the pH monitoring, patient should be remains non for orally for 6 hours. तो patient test करने पूर्व patient pH level टा तो gastric juice pH level टा को जानिया पाई टेस्ट रो 6 घंटा पूर्व कौन हुए पेशेंट को किसी खाइबा को दिया जाए किसी पीवा को दिया जाए पेशेंट नॉन पर ओरल रही है। सो फॉर द पीएच टेस्ट द पेशेंट शुड बी नॉन पर ओरली फॉर 6 hours बिफोर द टेस्ट and also do not take all medications and it is withheld for 24 to 36 hours before test. टेस्ट पूर्व 24 to 36 hours मध्य पेशेंट कौन से मेडिसिन हम ना कि टेस्ट पूर्व 6 घंटा टेस्ट पूर्व 6 घंटा मध्य पेशेंट कौन सी खाई नथिबो कि किछि ड्रिंक्स कर नथिबो। ओके, so tube will inserted through by the nose and it goes to the lower esophageal sphincter. Then the collect the sample and also monitor and all the pH should pH value of that gastric juices should be monitored. Okay, thank you.